Hi YouTube! So today I'm going to do a bit of a TMI video. Our University Safe Week, which stands for Sexual Awareness for Everyone, is coming up, and in the run-up to the planning, I've had a lot of conversations with people about contraception, and as it transpires, I'm a wealth of knowledge and personal stories about this, so I figured I would share it with you. I guess the most important thing to start off by saying is that these are my personal experiences. They could be completely different to yours. That's just how bodies work. But I think sometimes it's useful to hear what other people have to say, hear people's experiences and see if it helps you, which hopefully it does. Obviously, this information shouldn't go in place of anything a doctor or nurse or family planning clinic tells you. I'm not an expert on anything. I just thought I'd kind of give you a bit of a rundown of my contraception history. So this should be interesting. So back when I was about 15, I was put on the contraceptive pill. It was mainly because I had really heavy, gross, painful periods. You're welcome. I'm incredibly forgetful, so the pill's probs not for me, because if I missed one, I'd take two, and then if I missed three, I'd take three, and it's a lot of hormones to have all at once, so it wasn't great for me. But I have friends who have been on the pill for years, and they're so good at knowing when it's time to take it. So after that, I decided to move on to the depot injection, because I only had to worry about it every 3 months, and 3 months comes around surprisingly fast. It's actually what I'm on now, but I was originally on it kind of a few years ago. The doctors I went to, they did it in my arm, and all of my friends were like, no, it definitely goes in our bum, and I was like, nope, it doesn't go in my bum. So I changed doctors when I went back home to get my injection, and she was like, oh, put your trousers down, and I was like, excuse me? And she was like, it goes in your bum. I was like, no it doesn't. Apparently it does. So, and apparently it's ever so slightly less effective if it's in your arm than in your bum. So now I call it my bum jab. It's pretty useful. You've got kind of a window of a few days. The thing to note about the injection is that sometimes it can take kind of a year for your fertility to come back, so you have to know, or like it's useful to know if you plan on having a baby in a year's time, which is quite scary. And a really great thing about the depot injection is it can be started at any time in your cycle, so you don't really need to know kind of where your moon's at. That's kind of my favourite at the moment. I don't have periods, so buzzing for that. When I went to uni, I got the implant. This lasts for 3 years. It's a little rod kind of this big. It feels like a pen. It grosses you out on other people, but on you, you're just like, look how gross this is. It didn't hurt to go in at all. Like, I'm not a brave person. I don't cope well with pain. I think the worst thing for me was the fact that I had to go to the pharmacy and pick the little device thing up before I had it done. So it was like, it looked like a kind of, like a, I don't know, like some kind of contraption, and I could see it was gross, and it just kind of went and it was in, and it healed fine, it wasn't a problem. I'd had it in for about 1.5 years, and we went to America, and I had the worst mood swings of my entire life. Like, I was having the best trip, like with my boyfriend, one of my friends, and we were just like, trip of a lifetime, and I was sad all the time. So I was reading an American magazine, and they had a section, people who basically said that they'd had the implant and it had caused their emotions and their hormones and stuff to go haywire. So, and there's maybe 2 of my friends who have implants who have said the same thing, so there are a whole lot more people who haven't experienced this. But it's good to know. It was a shame that I had to get it taken out. It didn't hurt in the slightest. So then I had the incredibly clever idea of going for the coil, the interurinary device, which me and my friends affectionately called the vajanka, which is essentially a vagina anchor. So it's like a tiny little anchory thing, and they put it in your cervix, and it's like it's a thing. And I was like, yeah, this would be such a good idea, like, you know, go and have a big consultation about getting it done. And then I'm sat with my legs in the weird stirrupy things, completely undignified, with 3 different people just having a good old look inside me, with what looks like a Hoover inside me, and they're just having a good old snooperoo in me in my nether regions. And I've got one nurse holding my hand, and she's great. And then they do it, and it's the most pain I've ever felt in my life. Like, it felt like, oh. I read a forum a few weeks later, and someone described it as having their cervix toenail clipped, and that's the only way I can describe it. And I squeezed hold of the poor nurse's hand, and I screamed to the point that Stephen could hear me in the waiting room. Like, it was so painful, and I even apologized for how much, because I'm pretty sure I broke a bone in her hand. You know, but then it was done, and I thought it'd be great. So I waited for that pain to settle down. It was literally like the worst period you've ever had in your life, but for like 3 or 4 weeks, and it was absolute agony. Like, I can't even describe how painful it was. And eventually I Googled and did some searching and had a look. I found out how you could take it out yourself. Don't worry, I didn't, but it got to the point where I was very ready and willing to. A really, really lovely nurse who dealt with it, and she was like, well, you know, you tried, and I was like, oh. And it coming out wasn't great feeling, but it was the least amount of pain I'd been in the whole time. So as useful as that would have been for not being pregnant for a few years, it was painful and horrible. So yeah, then I went back on the injection. It was pretty simple. So yeah, that was my too much information roundup on contraception. I'm a big oversharer, but even I think this is a little bit odd. But still, hopefully it's useful to you, and if you have any questions, you're more than welcome to ask me. Or, you know, if you've had different or similar experiences, let me know. Let's chat about contraception. Why the crap not? Pop it down in the doobly-doo commenty box, and I'll be sure to answer all of them. Thanks very much. Bye! Yeah, what are you supposed to say about condoms? Use them.